Today, we are going to be talking about mental health in sickle cell disease. Hello, and welcome to another episode of Dr. Simone Says. My name is Simone Eastman Yuan. I am a medical doctor with sickle cell disorder, and I am also a best selling author of the book Doctor in a Patient's Body Dreaming Big with Sickle Cell Disease and Chronic Pain. But these days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that you live well. I saw an article that said sickle cell and mental health, the elephant in the room, and I couldn't agree more. It is so huge with sickle cell. So I made some notes because I wanted to cover some things. Obviously, if you can Google it, that's not what I want to be talking to you about because you are bright people and you can access information. But I want to discuss some things that you might not find in the textbooks sometimes, and so, or not as easily. And so, I will start with what is mental health with regards to sickle cell disease. So, it will range from your general well being to mood disorders like anxiety and depression. And it can go on to chemical imbalances. We hear about things like bipolar disorder and then things like schizophrenia and on. And these all have different categorizations in the world of psychology in the DSM manual. But for the purposes of sickle cell disease and how we live day to day, I think we are more likely going to be talking about mood disorders like anxiety and depression around the everyday coping with sickle cell disease. Um, let's start with the fact that mental health should be, or even anxiety and depression should be a diagnosis of exclusion in a way. And here is what I mean by that. Oftentimes, there can be other things that can cause anxiety and depression. And because we have sickle cell disease, a lot of times we are not adequately worked up. In other words, when we present, everything seems to be related to sickle cell disease. And people often forget that we are just as at risk for everything that everyone else struggles with, everything that everyone else is diagnosed with, just because we were born with a genetic error in our, or mutation, I should say, in our programming, does not mean that we can't suffer from things like hypothyroid, which can cause low mood, or hyperthyroid, which can cause anxiety. But these have roots in organic reasons. And so, for that reason, I say, you kind of have to hunt down and do a workup and make sure that it's not happening from something else. We have plenty of reasons why it would be happening, but we need to make sure that it's not happening from something that could be fixable. Um, and speaking of fixable things, let's talk about tangible things, some more tangible things that could cause uh, mental health uh, problems with sickle cell. So, because we're sick, we can have a poor diet. Oftentimes our life can be so sporadic because of socioeconomic reasons. We can have less access to the types of foods and the types of treatments and the types of resources that we might need to be able to nutrify our bodies. And so we can end up becoming deficient in essential minerals, essential vitamins, amino acids, essential fatty acids. And so poor nutrition with those deficiencies can lead to a myriad of things, including a presentation of depression. And so we have to consider those things. Vitamin D, for example, I did a prior lecture with vitamin D deficiency and all the complications with respect to the fact that we have dark skin. So, because we have dark skin, we are operating at 10% absorption of what the our white counterparts would be experiencing. So we get 10% of what they would get if we exposed ourselves to the sun for about 15 to 20 minutes a day. And so we oftentimes can expose our bodies for much longer periods and still get very little. However, because oftentimes we are sick, we are indoors, we can't get out of bed, we're not very mobile, we're not even making it into the sun to get that 10%. And so across the board, African Americans, this is outside of sickle cell disease, African Americans and many people of color are at an alarming risk with vitamin D deficiency. Vitamin D controls a myriad of things, like over 200 different processes in the body. And we are chronically at risk for those diseases because of that deficiency. Furthermore, it is not always regarded the way it and treated quickly the way that it should be. I know for myself, I became critically low with a vitamin D level of 8, and I was not told for 2 years that I had a vitamin D level of 8 until I pursued the results extremely vigorously, and it was released, and it turned out that I had a very low vitamin D level. Meanwhile, I had, osteopenia that became osteoporosis. I had hip degeneration during that time with a hip replacement. Now that we all know that having sickle cell disease puts you at risk for that, but when you have all of the other confounding factors, you start wondering, which contributed to what and what started first. So we definitely are at risk, and we need to be able to educate ourselves so that even if our healthcare providers aren't picking up on these things as quickly as they should, that we can take care of ourselves and live longer. Um, so that's about vitamin D. We definitely need to replete with vitamin D because we are going to be deficient and we're not going to get it in the sun. And to be able to absorb vitamin D, you often will hear that magnesium is critical, and calcium absorption is complicated as well. So calcium, vitamin D, and magnesium, they're all needed for full and proper absorption. And so so we could be missing any one of those things and making it very difficult to be able to get our calcium in our bodies. The other thing I want to talk about is vitamin B. So we are often told that we need to take a B12. Oftentimes, if you were to ask your healthcare provider if the other, B1 through 11 were measured, they're not measured. But it's fair to say that if you measure your B12 and it's low, there's a very high likelihood that the others are low. So what you should be repleting with or taking is not just a B12, but a B complex with everything, and an absorbable source. Your B vitamins are needed for detoxification. It's needed in your brain for all sorts of processing. And if you don't have that on board, your body is not able to detoxify. So all that garbage is staying in your bloodstream and compromising your system even more. So those are things that can lend themselves to depression, because you're going to be feeling sicker. You're not going to be feeling your best self, even on a good sickle cell day. You might have other confounding factors that might not make you experience a great a day as you should. And so those are all things to take into account. Um, Serotonin. So we know that oftentimes when someone goes to um, their physician and they're diagnosed with depression, someone will start them on, or their doctors will start them on um, a serotonin. It's called a serotonin reuptake inhibitor, because serotonin is your happy hormone. It's what you need a lot of and oftentimes don't have enough of. What is serotonin made of? It's made of an essential amino acid called tryptophan. So if you're lacking in your essential amino acids, you're likely lacking in a lot of the building blocks for your neurotransmitters and your hormones, including your happy hormone, serotonin. And so once again, diet becomes important, because you need to be able to provide the building blocks for your body to be able to get things up and running, and all the different cofactors that are needed with your minerals and things are going to come into play, is going to become essential. So you can't have a discussion about depression without having a discussion about diet. Food is medicine. Um, I want to talk about some other causes of depression, though, that we are more familiar with. And that is, oh, actually, I want to talk about one more kind of organic reason, and that is your prescription medications. So, there are a lot of prescription medications that cause depression as a side effect, and most people won't know half of them. So, you might be experiencing low mood and just thinking that it's part of your sickle cell disease process, or that you're depressed because of that. But a lot of pain medications are central nervous system depressants. So you could be experiencing it from that, and not necessarily your sickle cell disease, but your sickle cell disease will likely compound the problem. So let's go back to what I was just saying. Some other causes that we're more familiar with. And it is just the fact that sickle cell disease is a life threatening illness. We are constantly being told how long we will live. And we will meet that milestone, and then another milestone will be set for us that's not far down the road from that. These days, it's becoming at least a little more common for people to say, okay, they will live into their mid 50s. But you talk to the average sickle cell patient, and they will tell you that, oh, their parents were told that they wouldn't make it this far, and then they finally passed that milestone. So imagine what it would be like to just live with, and I'm saying this for the people without sickle cell that might be watching as well. Imagine what it would be like to live every day thinking that you're getting closer and closer to the end of your natural lifespan, and only to surpass it. And because you thought you weren't going to live long, you didn't make any long-term plans. You didn't invest in anything long-term because, well, you weren't going to live anyway. And so this can cause great deal of depression, because you can start just watching your life pass you by, and then you pass those milestones, nothing has happened, you're still ticking along, but you have nothing much or nothing significant to show for it because there wasn't an investment, there isn't a legacy because you thought that you shouldn't have one. And I want to urge you to dare to reject that philosophy that you hear from the healthcare industry sometimes. Not everybody. I know that there are many people that champion us. I am not speaking about that, but there are way too many narratives that run like that are counter to life and the pursuit of health and happiness. And I want you to remember that people that have other illnesses are at risk of dying too. Like we can be healthy and walk outside and get hit by a truck. And in fact, uh, in the last several years, I have actually witnessed close friends of mine who used to mourn for me, mourn for the things that I was going through. And they were healthy and they suddenly became ill, died, and they were gone in a moment's notice. One passed away just from health, apparently healthy, obviously something was wrong, but just dropped with a heart attack and was gone. So um the truth is nobody knows how long anybody has on the earth. And so I want to ask you to reject that narrative and to invest in yourselves and in the future, because you will look up one day and realize that because you sowed along the way, you have a lot to reap. And I hope you can hold on to that. Um, Something that I just started writing about in my book, and so I'm not going to go into to this a whole lot, but I want to just touch on it, and that is just mistreatment by medical professionals. I truly believe that we are being bullied, victimized by the very people we entrusted our care with, the very people that we dare to open up to and be vulnerable with. When we are sick, we turn ourselves over to them for their care, only to be told that, our pain is not as bad as we have, are making it out to be. So then now we have two choices. We can either believe what they are saying, the medical professionals are saying, and then not take care of ourselves, putting ourselves at risk, or we believe what we are experiencing in our bodies. And in that case, the people that we entrusted our care to, the people that we trust, suddenly become not so safe because they are telling us not to believe our lying eyes and lying five senses because our senses are telling us something is wrong, and we are experiencing the complete opposite of that. And so that breaks down a lot of trust, but it also creates a trauma because then we don't know where to entrust our health when someone is telling us there is nothing wrong and we're feeling like we're dying. And so I do believe that there is a PTSD that can be occurring from that, a post traumatic stress that could be happening from that. And that in itself is creating a mental health issue that no one really talks about. So we really need to be able to educate our doctors and nurses in order for them to not perpetuate the trauma that is happening at the level of care, at the level of trying to obtain care. I also think that there is a trauma that we experience when we entrust ourselves to medical authorities that ask, "When did you get sickle cell disease?" Just that question alone is scary because it is genetic. You are born with it. And so if someone is asking you, when did you get it? It is the biggest red flag that they don't know what your disease is, and they don't know what they are talking about. And for any patient, the red flags will go up because they're now thinking, oh my gosh, I have a complicated disease, and this it doesn't seem like the staff, the medical doctor, and everyone else, it doesn't seem like they know what I'm going through, and they don't know what to look out for, and I could possibly die in their hands. And that is a very scary thing to experience when you're that vulnerable and you're presenting to the hospital for care. And so a lot of education needs to happen around that so that that can be minimized. I think, the ignorance around sickle cell disease and why it's dangerous to have people wait in the ER, why it's dangerous to tell people that they are not hurting when they obviously are. We don't treat pain for comfort. We treat pain because it is releasing a lot of stress hormones in the body, and people can die because of that level of pain. It is the reason why when people go into the OR, they're given anesthesia, because that amount of pain can actually overwhelm the heart, and people could go into heart failure and die. And in fact, a lot of people with sickle cell disease have that. They usually will present with a sickle cell crisis, but you will hear that they had a heart failure, and it's usually because systems crashed, no one paid attention fast enough, and so people went into heart failure. So what can we do to remedy this? My thought is that, one, you have to arm yourself with information so that you make sure that you are. I know it's offensive to even think that you would have to teach your provider, but if that is what is going to keep you alive, then that's what you do. The second thing is to bring someone with you at the point of care, especially if you are vulnerable. Most times you will be and not able to speak for yourself. Someone who has a binder with lots of information to provide for any situation that may come up, including lack of understanding about pain management or lack of understanding about the acuity of the presentation of the sickle cell presentation. So those are things that I think would help. The other thing is, you know, everyone has taught us that the only thing that will help us is our narcotic pain regimen. And I will say, when uh, you haven't availed yourself of other resources because you're not told, then that is the only thing that is left. When nutrition isn't pushed, um, when other alternative methods aren't pushed, and you are not even made aware of them, then it does seem like narcotics will be the only thing, and in high doses as well. Um, I am not saying that it won't be part of your regimen, but it would be wonderful if we could make use of all the other tools in the arsenal so that it could minimize what you would need in the ER. Because wouldn't it be nice to be able to say, take your narcotics and shove it. I just am here for IV hydration and to find out if I have an infection that's triggering my sickle cell crisis so that we can stop it. I mean, it would be wonderful to be able to say that. Right now, we're not even anywhere close to that, right? Right now, a lot of times, the only thing that does um, stop the pain is a narcotic analgesic. But I think it would behoove us to make use of everything that is available to us and to learn everything that's available to us so that we don't have to go to the ER as often. And then when we go, we don't have to stay as long. Because the only way to take back our power in that situation is to reject what it is that whatever carrot is being dangled over us and we can't seem to reach. If it's the medicine that's being dangled like a carrot over us and yet we can't get it, wouldn't it be nice to suddenly be able to say, feel free to dangle the carrot, but I don't need it, not today. And so, but those are things that cause frustration, and those are things that cause depression and anxiety, because when we don't feel like we are in control of our treatment and of our prognosis, it will generate a lot of anxiety and depression. And the thing to do to be able to control a lot of that is to do what you know how to do, is to arm yourself with information and to put what you know how to do into practice, starting with uh, good nutrition and prevention. All things prevention, whether it's avoiding the cold, or it is having a plan for when you are in the cold, whatever it is. But trying everything you can to minimize having to deal with the emergency room setting until people become more educated. It's unfortunate, but that is where things are. One of the things that I would recommend, because of how prevalent depression is, I read one study that actually, and these studies are not even current, there's so little to be found, but in comparison to our average African American population, which, by the way, I think is artificially low, because not a lot of people even report. I mean, culturally, it's such a taboo to talk about anxiety and depression or any kind of mental health. So, not a lot of people will be reporting. And then on top of that, um, um, so the numbers will be artificially low. And then when you look at sickle cell, it's no different. We will have the same pressures. There are family members who will tell you that you're doing things just to get attention. I can't believe people actually hear these things, but it happens because of ignorance, because people haven't walked in your shoes and experienced the intensity of pain. When I experienced my worst sickle cell crisis, I couldn't believe that you could feel that much pain and be alive. So, of course, I know what your pain is like, and I know that it's valid, and I know that it's chronic, and I know that it can happen at that level every single day. Um, but oftentimes our family members and the people in our community don't. And so we will try to hide our depression and also not report it. Yet the report showed that we are 5 times more likely to have depression as part of our presenting diagnoses when we have sickle cell disease, in comparison to our African American population that don't have sickle cell disease. And it increases in every decade. So from, I think the worst decade is like from 30 to 39. And I thought about why that would be. And I know that a lot of times we cross over from pediatric to adults, and we spend that like from 21 to 30 kind of trying to figure out how we are going to navigate our own health, because we've had our parents and other people helping us along the way. And suddenly we went from being a baby where everyone was sympathetic, or a young child where everyone was sympathetic and believed you when you said you had pain, to crossing that threshold of 18 or 21. And suddenly you went from, a child in pain to a drug seeker, you know, in a matter of of weeks, and then you have to live with that reality and grow up and figure out things in that reality. And so it only goes to figure that as you continue down that path and into adulthood, that depression would, start to increase and creep in. And I'm sure that there are other factors that I may not even be thinking of right now that could explain why by the time someone gets to about 30, their depression, the percentage, the prevalence of depression is like at a all-time high. Um, so with that said, I think that I would recommend that the plan be that you're assessed yearly with an evaluation. And I know some people will not agree with this, but if you have a positive, diagnosis for depression, then obviously you wouldn't need to be evaluated for depression. But if you did not have a diagnosis of depression, it doesn't mean that one year you couldn't suddenly become uh, uh, depressed or struggling with depression. And so I do think you should pursue, or ask your primary care doctor, please refer me to a psychiatrist, please refer me to a therapist, a psychologist, someone that I can kind of just sit, and even though I may be feeling fine, let me just sit and flush things out and make sure that I'm doing well emotionally and psychologically. I don't see how that anything could be wrong with that. In fact, it's a very healthy way to go, to always examine different parts of your life, and your mental health is no different. Your mental health is no different for arming yourself preventively so that you're not reacting when things are falling apart. Um, that's all that I have for my talk today. I imagine that I will probably have a um, uh, part two to this, as I have a plan to have a discussion around this video, and see what comes up of it and what maybe I need to include in the next video on this topic. Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver and not just a survivor. If you have benefited from this video any at all, please like the video, comment, and subscribe to the channel, and then share the link with one other person as your contribution towards the sickle cell cause. Have a great day.